I would appreciate it if people would start to head towards wherever they're going to sit, and especially the speakers, wind your way up to the front. As we start into our afternoon, I've gotten some good feedback, and I'll share it with you as we go through our program. People are asking, how does this relate to my CDRN, what I'm trying to do in my daily life working with PCORNet? And also, what are the specifics? Are there going to be recommendations at the end of the day? This is a workshop, and it was deliberately designed to go from the general to the particular, or to the more specific. And I hope, and please tell me if it's not doing it for you, that we're moving from laying the groundwork and establishing the backdrop to issues that are going to be, I think, very relevant to those of you who are building CDRNs and aspiring to be part of PCORNet. So with that as an opening expectation for the rest of the day and tomorrow, I'm going to turn to an issue that came up right from the beginning of the PCORNet steering committee meeting, which is the conditions for sustainability. Lou Sandy, Executive Vice President of UnitedHealth Group, an old friend of mine for many, many years, is going to moderate this session, and he will introduce the speakers. Lou?
Well, great. Good afternoon, everyone. And I think, from my point of view, this is really one of the key sessions of this issue of sustainability. I spent 13 years at the Robert Wood Johnson Foundation, and I think, and PCORI has been in the same position that other funders have been, which is once you get something started, you immediately address the issues of how do you promote sustainability. And I think we've already heard this morning about the importance of context in promoting sustainability as well as culture. Before I introduce our speakers, I just wanted to highlight, I think there are at least three things I heard as part of the changing context which might contribute to sustainability that I thought I'd put on the table for our discussion. The first one is around the issue of payment reform and alignment of incentives. I think what I would share is that I think the world is moving very rapidly from paying for volume to paying for value. UnitedHealthcare as a national payer, for example, currently has $28 billion of its spending tied to performance-based contracts, and we've publicly committed to doubling that in the next couple of years. So that's a big change in the way payment is going to be structured, which is an important contextual factor for health systems. The second one, and Sally will focus on this, I think in particular, is the changing role of the consumer. First, there is greater consumer cost exposure and sensitivity in the private marketplace, but beyond that, the role of the consumer is changing in a very meaningful way, which will itself have significant impact on the context as well. And the third is the issue of transparency. There was quite a hubbub relating a week or two ago to the release of the Medicare data and on the physician volume and prices and so on. And I think that's just the latest example of the sea change from moving into a world where we will have significantly more augmentation of tools to promote transparency around quality, around cost, around the consumer experience, and around this idea of value. So those are at least three things that come immediately to mind. But there will be many other factors, and that's what our speakers will get into today. Let me introduce our first presenter, Brent James. Many of you know from Intermountain Healthcare. He's the Executive Director of the Institute for Healthcare Delivery Research and Vice President of Medical Research and Continuing Medical Education at Intermountain Healthcare. And he really has been a national figure for decades, I think, in driving not only improvement, but actually I think more importantly, how to think about improvement. Because I think this kind of metacognition around how to create a sustainable system for improvement, he will share with us. And then we will have three panel responders. The first one is Tom Garthwaite from HCA, the Chief Operating Officer and Vice President of HCA Clinical Services Group. Before joining HCA, he was the EVP and CMO of Catholic Health East and was at the Los Angeles County Department of Health Services and Undersecretary for Health at the Veterans Health Administration. Following Tom is Sally Oakham from Patients Like Me, the Vice President for Advocacy, Policy, and Patient Safety. And she and Patients Like Me have been strong forces for the patient voice in a number of national advocacy initiatives and in developing infrastructure for collecting and amplifying the patient voice in research and in quality improvement. And lastly, but not least by any means, is Karen DeSalvo, the National Coordinator for HIT. I think it's fair to say that the ONC was instrumental in promoting PCORNet as well, so I think she'll have a set of comments not only related to her role as the National Coordinator for HIT, but the broader issues around the information infrastructure that's available and emerging to promote learning health systems. She is relatively new to HHS, and we've known each other in her past lives. She was Health Commissioner for the City of New Orleans, and New Orleans Mayor Mitch Landrieu, Senior Health Policy Advisor. So with that,